Hello everyone, how are you all? Today we are discussing the important calculation questions. Third question, plasma concentration attained by a drug after administration and the initial dose of 1000 mg in the body is 50 mg per liter. What is 50 mg per liter? That is the plasma concentration attained when you administered the initial dose of 1000 mg. So you have injected a 1000 mg drug. What is the plasma concentration? That is 50 mg per liter. What is the T half? That is 2 hours. Estimate the rate elimination of the drug. We have to calculate rate of elimination. Okay. First, we should know this is little bit a lengthy question, but they will not give 3 or 4 steps questions. They will give the questions which can be solved by 2 steps. Okay. But sometimes we can't predict, isn't it? So knowing this question is also very important. So you can learn here 3 formulas. This is the question of format. Okay, let's see. First is, what is rate elimination of drug? Something is getting eliminated, that means clearance. What into clearance? It is how much is present in the plasma into the clearance. How much is getting cleared. That is the rate of elimination of drug. To calculate this, we need plasma concentration. How much? They have given 50 mg per liter. What is clearance? They have not given clearance. So we have to calculate clearance now. What is clearance? Clearance is something that is you have to multiply 0.69. That for the easy calculation, we can take this as a 0.7 into apparent volume of distribution divided by half-life. Okay, something is cleared in some time period. Okay, so apparent volume of distribution divided by half-life. Can you repeat the formula? Clearance is equal to 0.7 into apparent volume of distribution divided by half-life. Okay, but half-life we know that is 2 hours, whereas apparent volume of distribution is not given. So again, next third step is to calculate the apparent volume of distribution, AVD. What is that? Initial concentration of the drug divided by plasma concentration. How much did we administer in the initial? That is 1000 mg. What is plasma concentration attained? 50 ml per liter. Okay, so this much is given in the question. We have discussed this. Initial concentration 1000 mg, plasma concentration 50 mg per liter, T half is 2 hours. First, we have to calculate apparent volume of distribution. That is initial concentration divided by plasma concentration. How much? 1000 mg divided by 50 mg per liter. Okay, mg also cancels. This is 20 liter. Liter will remain, right? So it will come up. So 20 liter. Okay. We got apparent volume of distribution now. What is the clearance? That is 0.69. That is, we are simplifying it, 0.7 into apparent volume of distribution divided by T half. What is apparent volume of distribution? That is 20 liter. Divided by T half is 2 hours. So 2 ones are 2 tens are. So multiplying 0.7 into 10, that will come as a 7.0. Next, the rate of elimination. This was the asked in the question. That is how much is getting eliminated. That we have to multiply clearance into what? Plasma concentration. How much is in the plasma and how much is clearing off. What is plasma concentration? 50. What is clearance? We saw now. That is 7.0. How much? 7 5s are 35, 350 mg per deciliter. Okay, sometimes they will give just ask a apparent volume of distribution. Sometimes they might ask a clearance only. So here we are dealing with all the three. So this is very important question. Okay, happy Deepavali to everyone. And this Deepavali will give you a sparkness, that light, that happiness, that positiveness. Yes, everything will be good. Happy studying, happy learning. Take care, everyone. Bye bye.